Daycares and other public institutions in Quebec that serve halal or kosher food are wondering how the province's new secularism law will affect them. The law, which was tabled last month, says that no public institution can offer exclusively a diet based on a religious precept or a tradition. That's creating some confusion.
I've heard very little in terms of how that detail would look like. I think it's all up in the imagination right now.
How do we navigate this? How do we navigate the kosher food or the halal food or whatever other food restrictions other communities have?
The minister responsible says it's not that complicated. Here's how he explained it when he first tabled the bill.
They can serve kosher meal, but they will have to serve some other food too, to enlarge the offer.
This would affect mostly publicly funded or subsidized daycares. Many of them serve exclusively halal or kosher food, even to children who aren't Jewish or Muslim, simply out of convenience.
It doesn't change the taste, I don't think. It doesn't really change the material nature of the meat or the poultry itself.
In a statement to CBC, the association representing publicly funded daycare says the new law raises many questions. It's important to understand that those responsible for providing food in childcare centers have to work with limited suppliers and budgets. So what will a manager do if the only suppliers able to meet budgetary constraints offer, for example, only halal or kosher products? In some cases, it could mean a daycare might require 2 separate kitchens.
So, for example, a kosher kitchen is, very particular, and you can't bring other food into a kosher kitchen without it no longer being kosher. And so, how do you navigate that while serving all communities and serving your community as well?
Beyond daycares, the institution that could be the most affected is Montreal's Jewish General Hospital. The hospital's patient guide online says all of its food preparation services are kosher. A spokesperson told CBC non-kosher meals are available, but didn't offer any other details.
Does that mean that that the Jewish General Hospital has to build a new kitchen?
CBC has repeatedly asked the hospital about the bill since it was first tabled. It will only say that it's still studying the situation and analyzing potential impacts. We also asked the minister responsible what he thinks about all these concerns. In a statement, his spokesperson says there are no exceptions provided for in the bill. However, it's important to remember that we're still in the tabling stage. Before answering more specific questions, it's necessary to consult with stakeholders and have a detailed article-by-article review. Muslim and Jewish groups say they're ready to participate in that process.